Hello everyone, my name is Jodin J. Digna, base IT of Western Institute of Technology.
As the world faces COVID-19, there are several measures one can take to help fight this virus. Here are some ways to prevent the spread of the virus. Number 1. Avoid big crowds. Number 2. Maintain a distance of at least 1 meter between you and the person who shows symptoms of the disease. Number 3. Always cover your mouth or nose with tissues or your arm when coughing or sneezing, and immediately throw away used tissues. Number 4. Avoid touching your mouth and nose. Number 5. Wear a face mask if you are experiencing fever, cough, and colds. Number 6. Wash your hands regularly with clean water and soap. Number 7. Always bring an alcohol-based sanitizer wherever you go. If you are experiencing symptoms such as fever, cough, cold, shortness of breath, or having difficulty breathing, head to the nearest hospital as soon as you can or call the following hotline for assistance. DOH hotline 02-8651-7800, local 1149 to 1150. And to keep track of the current number of COVID-19 cases in the Philippines, you can go to ncovtracker.doh.gov.ph. We can beat this as long as we're always prepared and work together. For more information, you can visit the Department of Health's official website at www.doh.gov.ph. This is Secretary Martin Andanar of the Presidential Communications Operations Office.
The ongoing COVID-19 pandemic has highlighted the vast differences in approaches to the control and containment of coronavirus across the world and has demonstrated the varied success of such approaches in minimizing the transmission of coronavirus. While previous studies have demonstrated high predictive power of incorporating air travel data and governmental policy responses in global disease transmission, modeling factors influencing the decision to implement travel and border restriction policies have attracted relatively less attention. This paper examines the role of globalization on the pace of adoption of international travel-related non-pharmaceutical interventions or NPIs during the coronavirus pandemic. This study aims to offer advice on how to improve the global planning, preparation, and coordination of action and policy responses during future infectious disease outbreaks with empirical evidence. Globalization has altered the way we live and earn livelihood. Consequently, trade and travel have been recognized as significant determinants of the spread of disease. Additionally, the rise in urbanization and the closer integration of the world economy have facilitated global interconnectedness. Therefore, globalization has emerged as essential mechanism of disease transmission. This paper aims to examine the potential impact of COVID-19 on globalization and global health in terms of mobility, trade, travel, and countries most impacted. The effects of globalization were operationalized in terms of mobility, economy, and healthcare systems. The mobility of individuals and its magnitude was assessed using airline and seaport trade data and travel information. The economic impact was measured based on the workforce, event cancellation, food and agriculture, academic institution, and supply chain. The healthcare capacity was assessed by considering healthcare system indicators and preparedness of countries. Even through this coronavirus pandemic, we should look to God and not lose hope in Him. We need to be using this as an opportunity and discover the godly way of facing trials and tribulation in our individual lives and as a community. We should suffer with joy, just like Paul and Silas in the prison, and be patient knowing that after all this pain, it will be better, and those who kept strong and hold their faith in Christ will be rewarded more than they'll ever know by the Father.